Most individuals will experience some type of back pain more than once in their lifetime. That pain could be from any number of reasons, from just wearing the wrong type of shoes, a car accident, or simply old age. The spine is a major key in locomotion. When damaged, the effects can be debilitating. Intervertebral discs, or IVDs as I will refer to them throughout this video, are avascular cushions that do not receive their own blood supply. Because of this, they do not heal on their own. When you get paper cut or you break a bone, you heal because they have their own blood supply. This is not the case for the IVD. They are made of three parts. There are cartilaginous end plates that separate the disc from the vertebra. The outer layer of the disc itself, called the annulus fibrosus, or AF, and the central gelatinous nucleus pulpus, or NP. Cartilage damage and cartilage-related diseases are the most common causes of disabilities in the United States today, occurring in approximately 6% of the population of people 30 years of age and older at a cost to the economy of $128 billion. The prevalence of arthritis is projected to reach 25% of the population, or 67 million people, by the year 2030, as a result of the aging population and the obesity epidemic. Degenerative disc disease, DDD, is one example of back pain. Herniating discs are another reason for back pain. Herniations are when the AF is torn or weakened, causing the nucleus pulpus to spill out. The herniated portion, the nucleus pulpus, will compress a nerve, causing the pain in the lower back. To fix herniating disc or degenerative disc diseases, surgeons will often remove the disc completely in a procedure called a discectomy. The surgery would dismiss the pain for a short time, only to cause problems for adjacent discs, which could experience also degenerative disc disease or herniations. Another unfruitful course is to put a prosthetic in. The problem with this is the performance will eventually be limited due to mechanical factors such as wear and fatigue. You might be thinking, why not an IVD donation like they donate the heart or lungs? Well, just like with transplanting a heart or a lung or a kidney, no matter the match, there's always a chance that your own body will reject it. The field of tissue engineering exploits living cells in a variety of ways to restore, maintain, or enhance tissues and organs. Researchers have successfully created simple tissues such as skin, cartilage, and bone. Cells are grown on the scaffold in the shape of the organ they are meant to become, or a donor organ would be supplied. A donor organ? Didn't I just say donors are ideal? I did, but in the case in a clinical transplantation of a tissue engineered airway, scientists stripped the cells of a tracheal segment in a process called decellularization. This allowed the doctors to apply the recipient cells onto the segment. The graft immediately provided the recipient with a functional airway, improved her quality of life, and had a normal appearance and mechanical function at 4 months. The patient had no anti-donor antibodies and was not on immunosuppressive drugs. Scientists have successfully grown IVDs in labs in mice and dogs. In the picture below, this is actually a study of picture A at 0 weeks, B 12 weeks, C 14 weeks, and D 16 weeks. As time went on, the engineered IVD grew thicker, the AF became more white, and the gelatinous nucleus pulsar less transparent. We have a long way to go before clinical applications of tissue-engineered IVDs. Surgical strategies still need to be created, as well as a way to culture, harvest, and actually use human cells. Scientists are still unclear on what levels of mechanical performance would be required for engineered IVDs to perform and function properly.